Okay, and in subacromial bursitis is most commonly secondary to the inflammation or degeneration of the supraspinatus tendon. So, subacromial bursitis is the most commonly secondary to the inflammation or degeneration of the supraspinatus tendon. In the absence of inflammation, Bursae or merely acts as a synovial tissue in contact with each other with a very thin layer of fluid between them. So is the bursae is nothing but which is having inside the synovial fluid, isn't it? Yes. However, when inflamed, the subacromial bursa may decrease the subacromial space and acromial space available for rotator cuff tendon clearance. So, whenever this inflammation occurs, this subacromial bursa may decrease the subacromial space which is available for rotator cuff tendon clearance. Okay, this is about the bursae. Out of all those bursaes, this subacromial bursae is very, very important. And this subacromial bursa is formed by two bursaes. One is the subacromial bursa in continuation with the subdeltoid bursa. Both are collectively called as subacromial bursa. This bursa reduces friction to permit smooth gliding between the humerus and the supraspinatus tendon. And it acts as a secondary socket to allow the lateral rotation of the humerus during overhead elevation of the arm. Okay, and if any problem or interruption to this gliding mechanism leads to pain and also decreased glenohumeral motion, and it occurs as a primary problem, and the secondary complaint after this thing is the inflammation or degeneration of the supraspinatus tendon that is seen in the subacromial bursitis. Okay, so these are all about the bursae related to the shoulder joint or glenohumeral joint. In the next session, we are going to see coracoacromial arch. Thank you.